Hi, my name's Kerry and I'm the founder and CEO of Precious Wings. I'm also a nurse practitioner in paediatric palliative care and a mum. When my son Toby was stillborn in 2011, I went from being the nurse who cared for grieving families to being the one holding my own lifeless baby. Nothing prepares you for that. Some staff didn't know what to say. One handed me a list of 40 funeral homes and said, "Would you like to pick one?" She looked terrified, and it felt impersonal, procedural, like a box being ticked instead of actually truly supporting us. And I know she didn't mean to be unkind, she just hadn't been trained. That experience changed everything for me. It's why I started Precious Wings, to support families after the death of a baby or child of any age and from any cause, and to support those health professionals who care for them in those heartbreaking first hours and days. You might be surprised to know that bereavement care isn't part of standard hospital or university training. We all do annual mandatory CPR training, fire safety, professional conduct, but not how to communicate with patients and families. When a child dies, the time parents have with them after death is brief, yet every moment is so precious. We provide memory boxes free to hospitals to help families create tangible memories that will last a lifetime. Handprints, photos, a lock of hair. But there's so much more than just a box. Each one is donated in memory of another child, so it's like one grieving family reaching out to another, a beautiful connection that says, "We've been where you are, you can survive this, and we're here with you." A memory box is also a tool for health professionals. It helps them start gentle conversations and to guide families through those precious moments. But if staff aren't trained to introduce or use them properly, that opportunity and the proven long-term benefits are lost. In Brisbane's big main hospitals, there are bereavement teams and specialist staff. But in regional and remote areas, health professionals and families are often doing it alone. We know regional and remote hospitals are calling out for our education, but we can't reach them with our limited staff resources and no sustainable funding for our education programs. With your help, we can bring this life-changing education to 5 regional hubs, places where families and health professionals need it most. It's hands-on, practical, face-to-face training where staff can actually practice these skills in a safe, supportive space. People often ask, why doesn't the government or the hospitals themselves fund this? Believe me, we've asked too. But this type of training just isn't seen as essential, yet it is. And with your support, we can make sure no family, no matter where they live, faces the loss of a child alone. Thank you.